Okay, this final section on therapy, section 4, you'll find on page 506, talks about biological treatments, biological therapeutic treatments. And when you're talking about this, you are talking pretty much about three things. You're talking about drugs, you're talking about electroconvulsive therapy, and you're talking about psychosurgery. And I'm going to spend quite a bit of time talking about each one of them. Now, drugs are typically medications that will be given for any number of different disorders, but there are specific medications typically that work with specific disorders. So we'll start with antipsychotic drugs. You'll see that on page 507. These are drugs that are typically given to folks who suffer from psychotic disorders, most commonly schizophrenia. You will find that it will be given to folks who are in the midst of a full-blown mania if they are bipolar. Because as we mentioned in a prior test, it's very difficult to tell the difference between someone who's suffering from florid schizophrenia and a full-blown manic episode. The thoughts are scattered. They are running 100 miles an hour. Both folks tend to suffer from hallucinations. Both folks tend to be delusional. And just looking at the two of them, you really can't tell the difference between the two of them. And in all honesty, to get both of them to settle down, you need to give them antipsychotic meds. Now, there are a number of different types, especially some that inhibit dopamine. So if you look at the very bottom of page 507, you'll see drugs like chlorpromazine, also known as thorazine, haloperidol, also known as Haldol. These can block these dopamine receptors, as will a drug known as imipramine. Now, these sorts of drugs are very good at getting folks who are wound up when they're suffering from schizophrenia, getting them to settle down. Now, the difficulty is that sometimes with these disorders, schizophrenia in particular, if you take them off the medication, after a while, they can start to cycle up again. And that obviously presents a problem. And I wish I could remember the name of, there's a disorder that comes about from extended use of drugs like thorazine and Haldol. It's not myasthenia gravis. I cannot remember the name of it. But they mention at the end of it, while these drugs reduce symptoms, there can be unpleasant side effects such as muscular rigidity, impaired coordination, and tremors. I'd mentioned my grandmother, who actually was misdiagnosed with schizophrenia. The suspicion is she was actually suffering from major depression with psychotic features, was given these antipsychotic medications for close to 15 years. And as a result, she suffered from a permanent neuromuscular disability that caused her to tremor a great deal. And when she talked, her jaw would flap back and forth, and she simply could not sit still. It was as though she had Parkinson's. Her mentation was just fine. But she had significant muscular control. Sometimes it also manifests with this extreme tension. So they try not to give these drugs as much anymore. And fortunately, in the last, say, 20 to 25 years, they have developed a newer branch of medication that does a good job of damping down the florid symptoms of schizophrenia or the excessive symptoms of mania. And it doesn't result in these muscular discoordinations. And so they're giving those more and more to folks who are diagnosed with these disorders, and it's actually working out fairly well with them. One note from Beautiful Mind, if you watched it, at the end of it, John Nash said that he was taking the more modern neuroleptic meds, and Nash was actually an exception. He did not really take meds, which worked very well for him once he got past age 50. He was able to function really quite well, but he also refused to take it in his 20s, 30s, and 40s when the disease was really kind of running rampant with him. But he insisted, as it was shown in the movie, that schizophrenia was like just a disorder of the mind, and if he could learn to discipline his thoughts in such a way so that he could listen to the rational ones and disregard the irrational ones, things would work better for him. Typically, when folks have these disorders, they need to take their antipsychotic medications. So, to treat depression, one of the first things they will give, and I mentioned this in the mental health unit that we did prior, common forms of antidepressants include serotonin reuptake inhibitors and norepinephrine reuptake inhibitors. And in many cases, these do a very good job of controlling depression. Now, note, I said in many cases. Sometimes it doesn't. And I'm going to get to that in a little bit. But they're definitely, like Prozac, for instance, is a selective serotonin reuptake inhibitor. Pretty commonly prescribed and has really quite a bit of success with folks that suffer from major depression. Helps lift them out of it that much sooner. Now, bipolar is different. Someone, as mentioned, if someone's in a manic phase, you have to give them typically antipsychotic medications to simply calm them down. But you can't keep giving that to them, and it does nothing to treat the depressive part of bipolar disorder. One medication they have found that works quite well with folks that suffer from bipolar is to give them lithium carbonate. Now, lithium is a naturally occurring element, and all of us have a certain amount of it in our bloodstream at any given time. And for reasons we still do not understand, if you give someone who is suffering from bipolar lithium carbonate, it helps alleviate their symptoms. It's not that their mood swings completely stop, but the highs don't get nearly so high and the lows don't get nearly so low. Problem. Lithium carbonate, your blood levels of lithium need to be closely monitored. If they get too high, you can start developing serious organ dysfunction, and if it goes on long enough, it actually can kill you. But kidney and the liver in particular, as well as elements of the brain, can get permanently damaged by excess lithium. So when someone is on lithium carbonate, they have to get a blood test every week to make sure that their blood lithium levels are not too high, because if they are too high, then they've got to re-alter their medication. And typically folks that are on bipolar hate the blood test component of the treatment, and as a result, they'll take the drug, they'll take the lithium, they start to feel better, and now I don't need the drug anymore. And then they might go a while. Might be 2 weeks, might be 6 months, might be a year. But then eventually they're going to start cycling again. So that was why that woman that I've talked about many times, she kept going to therapy to remind her, and I believe she was on lithium. That's why I need to take my medication. Finally, there are anti-anxiety medications. These tend to be benzodiazepines, which are a form of tranquilizer. I don't want to oversimplify by saying that you treat anxiety patients by making them sleepy, but there is some truth to this. It's not as though they're going to be sleeping all the time, but it literally just takes the edge off their anxiety and then brings it down. Consequently, they tend to sleep also more easily, perhaps than most of us. There is a problem. Lithium, anti-anxiety meds, antipsychotic meds, they don't really make the person feel good, they just calm them down. Benzodiazepines, they can actually make people feel good, and there's a definite addictive component to them. So anti-anxiety meds can potentially be problematic. In the event medications don't work, there are two other alternatives, particularly for severe mood disorders, so like severe depression. So we're talking like depression with psychotic features. I once knew a woman, wasn't a client, was actually a friend of the family, who suffered from severe postpartum depression, and the postpartum depression then degenerated into some really psychotic features. This woman was maintaining some very, very strong delusions, was even suffering auditory hallucinations. And one treatment they considered was electroconvulsive therapy, shock therapy. And I know this sounds horrifying. It sounds like a medieval treatment. However, there are some folks who suffer from severe depression, bipolar, that will not respond to lithium carbonate, who swear by electroconvulsive therapy. Carrie Fisher struggled with bipolar her entire life. It contributed to her problems with drug use. But she was a firm believer in electroconvulsive therapy. She said she would go about every 6 weeks. And while it sounds horrifying, shocking, if I can make a terrible pun, it does seem to have an effect. And it's not as bad as you might think. It literally is not a case of you get hooked up to electrodes and then it's like you're sitting in the electric chair and the entire body starts to seize. They don't need to run currents that high. So there is that. There's the second thing, that there's a slight amount of amnesia that surrounds electroconvulsive therapy, so the patient never actually has a memory of the event. It's like having your wisdom teeth out, in that you don't really remember the teeth coming out, and it has an added bonus in that when you wake up, your mouth doesn't hurt like Hades, and you're just slightly tired. Again, when you're treating bipolar or depression that is severe and not responding to normal psychopharmacology to drug medications, ECT is definitely an option. Finally, and this also sounds medieval, there's psychosurgery. We used to be known as lobotomies or leucotomies. Now, it is certainly true that for a while in American psychiatry, lobotomies, also known as leucotomies, were done too much. If anyone wants to do some additional reading, I recommend reading One Flew Over the Cuckoo's Nest. It has an interesting insight into psychological hospitalization, psychiatric hospitalization, as well as lobotomies and the purposes of lobotomies. In the 40s and 50s, they were really somewhat common and kind of horrifying to consider. They'd actually take a giant hat pin and push it up your nose, up into the brain, and then literally stir it around. This would do damage to the frontal lobes and the prefrontal cortex, and while you would think that would cause a serious problem in terms of executive function, it would wipe out executive function to the point where the person would just sit with no response at all. And if you told them to do something, they'd do it, but you'd have to tell them. Otherwise, they'd just sit. So that, obviously, is not ideal. However, there are still forms of psychosurgery that are used nowadays. Do you remember our old friend, the split brain operation? The one that's used to control epilepsy? Technically, that's psychosurgery. Any type of brain surgery that results in alterations in behavior or mood, if they're carefully targeted, are still used nowadays, and sometimes they're used with some success. I will share another form of therapy, but it's not, there's no research right now to support that this is actually worth the dangers involved. It's a variation on electroconvulsive therapy, but they call it deep brain stimulation. This is where they're planting, when you do ECT, you just plant electrodes on the outside of your head. Deep brain stimulation talks about actually diving deeper into the brain, putting in small electrodes, and then electrically stimulating those interior portions of the brain. But that means diving into the brain tissue itself. Very dangerous. And there's not research that suggests right now that this will actually solve issues that surround, for instance, like florid schizophrenia and severe depression. And that is all I can think of with regards to biological treatments. Drugs, ECT, and surgery. And that's the end of the chapter, meaning what we got coming up next is your next assignment is going to be, that's right, we're still going to be doing worksheets, and there'll still be a Kahoot. Somehow I'm going to find some way to make this work. So thanks for sticking through this chapter, and we'll talk to you later.